Hello, I'm Dr. Mok Keyhole, a breast surgeon with a special focus on minimally invasive and oncoplastic breast surgery. My main interest lies in keyhole mastectomies, which aim to achieve excellent oncological outcomes while preserving aesthetics and safety. Over the past 5 years, I've performed over 100 keyhole mastectomies, including robotic-assisted procedures. I'm also actively involved in training and research to advance this field to improve patients' outcomes.
What is a keyhole mastectomy?
A keyhole mastectomy is a minimally invasive breast surgery technique where the entire breast tissue is removed through a small, strategically placed incision, often in the inframammary or lateral mammary fold known as the breast crease or in the axilla. This approach minimizes visible scarring while preserving the natural breast contour, making it particularly beneficial for patients undergoing immediate reconstruction. Robotic-assisted techniques further enhance the precision, especially in preserving nerves and critical structures.
What are the advantages and disadvantages of keyhole mastectomies?
There are many advantages to keyhole mastectomies and some disadvantages. The advantages include that of better cosmetic outcomes in that the scars are smaller and hidden, which results in less visible scarring. Because of the minimally invasive nature, there is less disruption to the surrounding tissues, and this can lead to potential better wound healing and less post-op discomfort. It also facilitates reconstruction in that it gives a more natural breast contour. The disadvantages of keyhole mastectomies include that of longer learning curve in that surgeons require specialized training in the techniques. There are also higher costs involved, especially robotic-assisted procedures. It is more expensive due to equipment and consumables. There is also longer setup time. Although the overall surgical time is comparable to conventional mastectomy, robotic-assisted cases may take slightly longer due to docking and preparation.
Is this surgery uniquely suitable for some patients?
Yes, keyhole mastectomy is particularly suitable and beneficial for patients undergoing immediate breast reconstruction as it helps achieve a more natural aesthetic outcomes. Individuals with small to medium-sized breasts without severe ptosis or sagging is also suitable as the incision placement is more favorable. Those with a strong preference for minimal scarring, such as younger patients or those concerned about body image, are also suitable. And of course, last but not the least, patients with non-invasive or early-stage breast cancer where extensive skin involvement is not a concern. However, for cases with extensive skin involvement, inflammatory breast cancer or larger tumors requiring significant skin excision, conventional approaches may still be preferable.
Were the results from the recent study in January 2024 comparing keyhole and conventional mastectomies surprising? Tell us more about their differences.
Yes, the results are not entirely surprising. In fact, the findings confirm what we have observed clinically, that the oncological safety and efficacy of keyhole mastectomies are on par with conventional mastectomies. The lack of significant differences in operating time, blood loss, and complications reassures us that this approach is not just cosmetically appealing, but also safe and effective. The improved wound healing trend aligns with the minimally invasive nature of the technique, as smaller incisions reduce tension and trauma to the surrounding tissues. The higher cost of robotic-assisted procedures was expected, given the additional resources required. However, as the technology advances and adoption increases, costs may come down over time.
How much more does a keyhole mastectomy cost at your center? Is this MediSave and insurance claimable?
The additional cost varies depending on whether the procedure is performed using standard endoscopic techniques or robotic assistance. Generally, robotic-assisted keyhole mastectomies cost around $5,000 to $10,000 more than conventional mastectomies due to equipment costs and consumables. In Singapore, part of the cost may be MediSave or insurance claimable, but the extent of coverage depends on individual insurance plans, and patients are therefore encouraged to check with their insurers for specific details.
Do you think keyhole mastectomies will become more relevant in the future?
Yes, I believe keyhole mastectomies will become more relevant as we continue to refine surgical techniques and technology. Patients today have a greater emphasis on quality of life and aesthetic outcomes after breast cancer surgery. With increasing awareness and demand for breast conservation and reconstruction, keyhole approaches will likely become a standard option rather than an exception.
Do you foresee keyhole mastectomies replacing traditional mastectomies in the future?
While keyhole mastectomy has the potential to become a preferred option for many patients, I don't think it will completely replace traditional mastectomies. There will always be cases where a conventional approach is more appropriate, such as advanced stage cancers requiring extensive skin removal or specific oncological considerations. As technology evolves, we may see a shift where keyhole mastectomies become the norm for suitable cases, particularly when combined with nerve-sparing or sensation-preserving techniques. Therefore, the future lies in personalized breast cancer surgery, where we tailor the approach to each patient's needs while ensuring oncological safety and optimal aesthetic outcomes. If you're wondering whether you're suitable for keyhole mastectomy, please do not hesitate to contact your breast surgeon or healthcare professional. Thanks for watching.